I really like the concept of Catholic social teaching as a lens for decision making. But one of the things that I really think about this concept of the lens is that I think perhaps Catholic social teaching may in fact be two lenses. Two lenses held together with a very particular frame. And one of the lenses of Catholic social teaching, I think, enables us to look into the immediate situation of those who are experiencing poverty and health and social vulnerabilities. It enables us to look immediately into their situation. But the other lens of Catholic social teaching is in fact the lens which enables us to look quite deeply into causes and systems and to see patterns that perhaps other people don't see. So these two lenses are held together with a very special frame, a frame that enables us to connect our ethical imagination, our capacity to wonder, our capacity to be curious and to imagine the situation that people who are experiencing poverty and health and social vulnerabilities are actually experiencing. So connecting that ethical imagination and allowing our emotional intelligence to grow, connecting it also to our capacity to think critically about how this situation can be changed and changed deeply at the cause, changed deeply at the systems level. So Catholic social teaching, I think, is a series of beautiful principles, but it's more than that. Catholic social teaching needs to come off the shelves of the library and into the everyday decision making that leaders in Catholic health and aged care are engaged in. And to try and get Catholic social teaching out of the library, I'd like to tell a couple of stories. One is a story that may seem like it's a long way away from here at first, because it is. It's set in the country of Ghana in West Africa, and a few years ago I was there with Caritas Australia, and what we were doing over there was working with a group of women. The women were part of a community perched on a very precarious cliff. And our work with them, the project that we had with them, was an income generation project. We were helping these women to help themselves out of poverty. It was a demonstration very much of Catholic social teaching principles such as solidarity. But it was also a demonstration, I think, of principles such as stewardship, because this project enabled the women to get a little bit of income, enough that they could improve the immediate situation of their family, perhaps a little bit more food around the table at night time. But it was also a loan that these women held in common. If you want a demonstration of the common good, try and have a loan together with a whole lot of other people in a group, and then work out how you're going to pay it off and what you're going to do with the savings. Stewardship, common good in action. So these women talked to us about the needs of their community, how they were going to try and address some of the social determinants of their own poverty. And they identified for us that one of the things that they would like when their savings got to a certain point was that they would really love a clinic that would help address their immediate needs, obviously, in terms of health. But they also identified the need for a primary school. And there were kids running around everywhere in this village, so we could understand both the need for a clinic and a school. And as good development workers should, we asked them to prioritise their needs. So I asked them, what will you do? What will it be in the end? Will it be a clinic or a school? And I thought that this vibrant group of women would talk amongst themselves and that they'd come up with an answer. But instead, everybody went really quiet. There was a hush over the group. I was quite puzzled. And the woman who was the leader of the group stood up. She looked deeply into my face and she said, You ask us to choose between a clinic and a school. Do you have to? The gospel eruption of compassion, obviously. Catholic social teaching principles in action, very, very clearly. But what the challenge of these women to us was to think more than just about the immediate. It was to think about justice. How do we change this system so that they have what we have? So that their choices are not life-limiting choices, but their choices are in fact life-enhancing. They need both a clinic and a school. Now that story might seem like it's in a faraway place, and it is. But I think for the contemporary leader in Catholic health and aged care, I think about the people in our systems who are our lowest paid workers. I wonder about the life-limiting choices that perhaps they may be making rather than the life-enhancing choices. I wonder about what our tables of governance and our tables of executives are doing about our lowest paid workers. And I'm thinking about the fact that there isn't just an eruption of compassion that gives a handout to the lowest paid. I'm wondering about what sorts of decisions we can make that will enable us to set up no-interest loan schemes, to use our resources for our own people in ways which enable them to be dignified in their lifestyle, that enable them to make some life-enhancing choices. We can do that when we make the right sorts of decisions about how we'll use some of our resources. It's not just the people who work with us, beside us and around us. It is the people who are coming into our hospitals and aged care facilities, the people who are experiencing health and social vulnerabilities. These are the people that Catholic social teaching principles are really aimed towards. And I'm thinking about a man that I met. This man lived in a boarding house. There are lots of people, lots of homeless people who live in boarding houses in the inner city. This man not only lived in the boarding house, he lived in the broom cupboard under the stairwell in the boarding house. This was a long time before Harry Potter made such cupboards very fashionable. He lived in that cupboard and he attended one of the St. Vincent's hospitals where his health needs were met. And we have a very comprehensive health program for people who are chronically homeless. And they are good programs. They are driven very much by the Catholic social teaching principles of respecting the dignity of the other. They're very much driven by the principle of solidarity. I think, though, that the invitation in Catholic social teaching is to look much more deeply into his situation and into the situation of people who experience chronic homelessness in ways which will lend themselves to ending homelessness. Not just supporting him to be more comfortable in the cupboard. Understanding his situation through the lens of Catholic social teaching that allows us to see what his immediate health needs will be is only one part of the invitation of Catholic social teaching. The other invitation is to use that lens where we look more deeply into causes and systems, and to use our hospital resources in ways where we're going to put some resources into research about homeless health. We're going to put some of our people resources into working with social service agencies such as St. Vincent de Paul and others, where we together can be involved in an evidence-based participation in health and social policy. It's this part where Catholic social teaching gets put on the map. This is the part where Catholic social teaching gets us away from just supporting someone living in a cupboard to the deep social changes that are at the heart of the gospel message. In both stories, what we've been seeing is the concept of participation and the concept of subsidiarity, those principles working very much hand in glove with one another. The days of making decisions on behalf of those who experience poverty, those days are over. How do we involve people in their own development? How do we involve them in their own human flourishing? How do we enable them to work from a strengths-based approach? Subsidiarity, participation, they work hand in glove and they need to be seen in the everyday. In what ways are we involving not only the poor, but how are we also involving other members of our staff? Where are decisions being made? In what spirit? Who's around the table? More importantly, who's not at the table? The most critical, ethical question that we need to ask ourselves as decision makers every time we sit around the table is, whose voice is not being heard? Yes, it's the job of the mission leader to amplify the voice of those who are marginalised and those who are experiencing health and social vulnerabilities. They have a particular role in amplifying the voice of those who are not at the table. But it is in fact the role of each of us as leaders in Catholic health and aged care to wear glasses that will help us to see the immediate, glasses that will help us to see causes and systems. And it's the capacity in each of us to make sure that we put those lenses together with a frame that says, this situation can be better. This situation can be changed.